My name is Jack Flynn. I am the Chief of Orthopedic Surgery at the Children's Hospital of Philadelphia. The first step for scoliosis treatment is making the diagnosis. So we want to see the family and the patient. We want to ask good questions about when the scoliosis was discovered. Does anybody else in the family have scoliosis? Are there any other issues associated with it? Then we need to do a careful physical examination to be certain that the patient has no other medical issues besides the scoliosis, and then we need to understand the deformity and how it's affecting the child, do a careful neurologic exam. When we're finished with the history and physical exam, we do a comprehensive radiographic analysis that includes both measuring the deformity, determining where exactly it is, whether it's in the thoracic area, lumbar area, or both, and then most importantly, figuring out how skeletally mature the patient is. It makes a huge difference if the patient has a ton of growing left versus they're skeletally mature, and that is done today with a bone age, which we can get as part of our initial x-ray. After we've gathered all the information from a history and physical exam and the x-rays, we feed this into a pretty simple system or algorithm that has been put together from an awful lot of research done over many decades. There's basically three standard treatments for scoliosis. Observation, which we do for small deformities less than 25 degrees in kids who are growing, and bigger deformities in kids who are completely done growing, maybe up to 45 degrees or so. If scoliosis crosses beyond 25 degrees in a kid with significant growth remaining, then bracing is recommended, and we'll use a brace until the kids are done growing. If scoliosis progresses beyond 50 degrees, then spine deformity correction surgery is discussed. So observation is used primarily because when we first see children with scoliosis less than 25 degrees, we can't be sure whether it's going to get worse at all. Or we see a completely finished growing 16-year-old who has a 40-degree curve. We don't know whether it's going to progress. So observation to us means bringing the children back about once every 6 months or so and repeating an x-ray and getting careful measurements. If we move to non-operative treatment, that often includes bracing with a combination, often with physical therapy in the mix if the family's interested, and then surgery is recommended when scoliosis gets beyond 50 degrees. There has been some recent good evidence that physical therapy methods such as the Schroth method help a scoliosis patient who is wearing a brace be more comfortable in the brace. It gives them body control. It allows them to sort of move their curve away from the push of the brace, and there's been some studies to show that they're more brace compliant. My Schroth patients also clearly gain strength in their core, their posture, their breathing, etc. Unfortunately, no evidence has ever shown that alternative methods like physical therapy, chiropractic, etc. can have any effect on whether the scoliosis is going to progress, or alternative methods like physical therapy, chiropractic are never alternatives to standard treatment methods like surgery or bracing. They are simply adjuncts. In terms of what happens if no treatment is done, it just depends on the child, their genetic makeup, how much growth they have left. Many children will have a small curve and it'll stay the same, and we follow it with x-rays about every 6 months. I'm very fortunate these days we have the slot scanning technology that we didn't have in the mid-90s when I started practice, so there's not much radiation cost to following these deformities closely. If we do see the scoliosis progress, it can be an inconsequential progression where it's just something we see on x-ray, or in bigger curves it can progress to really a point where it becomes a health problem. So scoliosis that gets to 70, 80, 90 degrees can impact cardiopulmonary function, can cause pain, etc., and certainly will progress into adult life as your bone gets softer. So that's why we really fix scoliosis deformities when they get over 50 degrees.